Thank you again for joining us for another educational video today. I'm Dr. Scott Whitten from the Nevada Center for Reproductive Medicine, and today I'm going to talk to you about what options do patients have when the male partner has had a vasectomy performed on them. Obviously, you know that vasectomy is a very common procedure that's utilized for contraception in guys. And what is performed during a vasectomy is there's a tube that takes sperm from the testicle out to the ejaculate, and it's called a vas deferens. So when you do a vasectomy, you're actually cutting or removing a segment of that tube, which interrupts the flow of the sperm that comes out in the ejaculate. So after a vasectomy is performed, guys don't really experience any difference in the ejaculation that they experience or the fluid that comes out, but there's really no sperm in that fluid. So when they come see me and ask, well, what can we do to get pregnant? Then there really is a couple of options for them. There's really three options for most guys and most couples. First option would be you could see a urologist regarding a possible vasectomy reversal. And that is a procedure done underneath a microscope in the operating room where they actually put the two ends of the tubes back together again and try to restore that flow of sperm back out into the ejaculate so a pregnancy could be achieved with intercourse. Unfortunately, depending upon how long it's been since the vasectomy was performed will really dictate whether that's potentially going to be a successful procedure for you or not. You also can't forget about the female issues that need to be taken into consideration, like female age, other infertility issues. So you can't look at it just as an isolated issue. You have to look at a couple, male and female, in total and see if it's the right treatment for them. So a vasectomy reversal would be done by a urologist, not by myself. I'm a reproductive medicine specialist. But what we would do in our office as option number 2 is we're able to actually extract sperm from either the testicle itself or the storage compartment on the side of the testicle, which is called the epididymis. And if you can see in this diagram, down here is the testicle. Right on top of it is this epididymal structure, and that is where sperm are stored and are waiting to come out in the vas deferens. So we can access that area with a small needle and actually obtain some sperm from there. There's two procedures that we use in our office, and it's performed under anesthesia. It's called a PESA, a Percutaneous Epididymal Sperm Aspiration, which simply means a needle's placed through the skin and into that structure to remove some sperm. Or we could do a TESI procedure, which is the testicular extraction of sperm, where we actually go upstream to the testicular tissue, remove a little bit of sperm there. Now, either one of those techniques, there is only a very small amount of sperm that's obtained. And therefore, we have to use that sperm very efficiently. So the only way to use that sperm is actually to do in vitro fertilization, where we can utilize a technique called ICSI, or Intracytoplasmic sperm injection. I know there's a lot of terms here. ICSI simply means taking a single sperm in a glass needle, placing it inside the egg and injecting it into the egg. You only need one sperm per egg, so you can actually get away with very few sperm. When you do that, it brings patients' fertilization rates back to normal. So it means the ability to turn that egg into an embryo by the sperm is that same as if I mixed a whole bunch of sperm with an egg in a dish and they fertilize normally. But unfortunately, this obligates you to the in vitro fertilization process. Fortunately, that has high success rates, and there's some added advantages of being able to look at genetics of embryos, and you can refer to our other videos for some of that information. The PESA and the TESI procedure also can be used for any kind of obstructive issues that are going on with the male genitalia. For example, there is a particular circumstance where guys who are carriers of cystic fibrosis, they didn't have vas deferens develop, or the vas deferens that's there is solid and not a tube so that sperm can go through there. In that case, you treat it just like you would a vasectomy patient. So there are other circumstances when we will use this procedure, not always in post-vasectomy cases. But the PESA and the TESI procedure are very good in-office procedures to obtain sperm in guys who have had a vasectomy and still result in very high success rates. There's still a third option some patients do consider, which is if the male doesn't want to undergo any procedures by a urologist or by myself, then the couple can decide to use donor sperm. And then you obtain donor sperm from a sperm bank. And the sperm is then inseminated into the uterus at the time when the woman is ovulating, helping them to get pregnant. Unfortunately, then and the male does not have a genetic tie to the offspring, and that most of the time that's what patients desire when they come in and see us. So keep in mind there's 3 options for most couples. If you want to learn more about these options, please come see us. I'm happy to talk to you more in detail about your particular situation. My name is Dr. Scott Whitten, Nevada Center for Reproductive Medicine. Thanks for listening.